And this latest spike in COVID transmission rates is raising concerns around the state, especially as we head into the next holiday, which of course is New Year's Eve. To talk about those concerns, we welcome Dr. Ulysses Wu from Hartford Healthcare. Thank you so much for joining us, Dr. Wu.
Thanks for having me again.
Okay, so let's first talk about what you're seeing as a physician. Are you seeing an uptick? What are you seeing when you're seeing patients?
Yeah, I mean, we're seeing exactly what was to be expected. We knew that once that the weather started getting colder, that we would start to see a rise in numbers, and that happened early on in November. And with the weather report, anything that's unseasonably warm is good because it drives people outside. But once the weather starts getting colder, it starts driving people inside, which the numbers started rising early November. Then we had, I think part of that was also driven by Halloween, but we had Thanksgiving as well, and we started seeing more numbers rising. And so the numbers, we look at it in two ways, not just the percent positivity that's out in the community, but the amount of people that are showing up in the ED as well as people in the hospital. And then when you look at those that are in the hospital, we break it down into those that need ICU care or ventilatory support. And all those numbers are up, but we should say that in comparison to the previous years, we're not quite what we're seeing in the other years, but we also have to deal with influenza and RSV as well.
Yeah, I've been talking about that for weeks now, especially for our younger people, right? So the children. Let's talk about the symptoms you're seeing too. Are you seeing a change in symptoms from other variants? I just know a lot of people now are experiencing more gastrointestinal symptoms and they're not thinking it's COVID.
Yeah, so gastrointestinal symptoms have always been a part of COVID, and we've certainly seen that all the way through the pandemic. But at this point, we are saying if you have any GI illness or if you have any pulmonary illness or upper respiratory illness like a head cold, those three things you really should be considering any of the diseases that are out there, starting with COVID, but you should also be considering influenza and RSV. And there are actually 10 other circulating viruses that are happening at this time that can also do those symptoms. Rhinovirus, adenovirus, human metapneumovirus, parainfluenza, they're all out there. So I would seek a test because at least some of them you can get treated, especially COVID and influenza.
All right, a lot to think about, especially as we head into New Year's Eve. Hopefully everyone stays safe and still masks, right?
I recommend masks when you're indoors. It's the greatest protection as well as vaccination.
There you go. All right, thank you, Dr. Wu.